local people said to us that they wanted services to be more joined up. They said they were surprised that healthcare, social care, hospital, GPs, community didn't really talk to each other as much as they would expect, and so they had to keep repeating themselves, and they found it difficult to navigate their way through the different services that are on offer. So we went about thinking how we could join up those services much better in the interests of the local people.
Stakeholder engagement is key to Better Together programme, and it's really important that we identify the stakeholders, so there'll be people who work in the NHS or work in social care. That I think more importantly, it's members of the public, it's people that access the services, voluntary groups, patients and carers. They have a large part to play in the Better Together programme.
It's been an exciting year for Better Together. We've now got joined up community teams which are much more strengthened than they previously were across Mansfield and Ashfield. They were already in place in Newark and Sherwood, but we now have across the whole of Mid-Nottinghamshire a much more thorough and joined up service in communities, and people are saying they feel much more supported and much better able to live independently.
The enthusiasm for this system is amazing, because we utterly and completely believe it's in the best interests of patients that they should be treated where they are most comfortable. That is the secret to PRISM, and it's wonderful and it works.
Transfer of care, or transfer to assess, which it was formerly known, is a discharge pathway that has been introduced to support patients who are admitted into hospital with an acute illness, who have been deemed medically stable, who may not be able to go straight home. So the process is set up to enable them to go home into a supported environment where they can be assessed by members of the integrated care team to ensure that their rehab potential can be realised.
The current challenges with the front door are that we have an out-of-hours service, GP service, and we have an emergency department, which are next to each other but are in separate parts of the building with two doors. And the single front door is the two services combined into one space. One larger waiting room with more facilities. The patient walks in the front door, they can still see the primary care stream or the emergency department stream. The difference being that the two staff groups are working in rooms next to each other. If a patient's seen by a primary care practitioner, it's quite obvious they have an emergency department need, they'll instantly be transferred across, and likewise an emergency department assessment nurse instantly transferred to the primary care stream. The whole goal is to get people seen by the right person first time, to avoid handoffs and duplication, and actually to make the best use of resource between the two groups, making sure that staff are seeing the right patients first time around.
We're really delighted that the excellent work that's already been happening as part of the Better Together programme has been recognised nationally, and we've been selected to be one of the vanguard sites for taking forward new ways of working and new models of care for the NHS and social care. And ours is one of the most comprehensive in that all of the services are involved. The type of change and the scale of the change that we need is always going to be a challenge. We don't underestimate that, but we have to keep addressing the challenges because this is the right thing to do for our population, and it gives us the best chance to have the best services going forward. And we do have to make sure that we get the best value for every single pound that comes into Mid-Nottinghamshire, so we get the best possible outcomes for people's health and well-being within the resources that we've got.
What's important is that they get home and stop at home.